This segment is sponsored in part by One Brooklyn Health.
Hip pain, knee problems, shoulder shenanigans. That's the medical term for it, of course. We're not just talking about all the ways it sometimes feels like my body is trying to tell me something. We are talking orthopedic care from our friends over at One Brooklyn Health. Welcome, Dr. Craveiro, and Dr. Voigt.
Thank you.
You came just in time, because I'm achy and shaky from all the working out I'm doing over the summer. So we're going to give our viewers at home some good information. So I'm going to start with you, Dr. Craveiro. What are the most common procedures you and your team over at OBH perform?
Sure. We usually offer a full spectrum of orthopedic care. Anything related to bones, muscle, tendon, ligaments, joints, we take care of it. Most common trauma and hip and knee replacement surgeries are the ones that we operate on. Hand and sports surgeries.
Sports surgery, so shoulders, hips, knee, ankles?
Ankles.
If there's a bone or a joint.
From the shoulder to the toes, that's what we take
From
care
the
of.
shoulder to the toes, I like that one. So how does someone know if he or she is a candidate for a replacement or a surgery of sorts?
That's a good question. So for hip and knee replacements, for example, most common is for arthritis. So if we develop with aging, wear and tear of the joint, the lining of the joint, the cartilage breaks down, and it can cause a lot of pain and stiffness. We first, in the hip, would be groin pain. In the knee would be a generalized pain on the knee, sometimes in specific areas of the knee, depending where the arthritis is bad. So we usually start with non-surgical options, injections, physical therapy, and medication. If that's still a problem, then surgical replacement is an option.
Okay. Lots of options before we go under the knife.
Exactly.
As someone who comes from a sporty family, we're well versed in this area. So Dr. Voigt, it's not just aging and arthritis that can cause all these aches and pains. There are sports injuries, daily life, myself included. I trip over my own 2 feet, and the next thing I know, I'm in the ortho's office.
And I completely agree, Alex. You hit it right on the dot. I think part of it is daily activity. So a lot of my patients succumb to injuries just basically in the knee, tendon injuries or ligament injuries such as ACL injuries. And a lot of them are from walking, running, or even playing any sports such as you said. About 200,000 a year get ACL injuries, and we perform about 100,000 surgeries.
Right. Now, not all of us are playing for the majors. Or, you know, going to Paris to compete in the Olympics. Can these injuries happen just from daily life, just from trying to get from point A to point B?
I mean, you know, usually ACL injuries occur from sports, and we all know that. We see it on TV. But our patients actually come in to see me saying, oh, well, I just walked down the steps and landed wrong.
Right.
And I have that more than often. And we get other injuries just because of the uneven pavement and the roads here, so including my own godmother. So, yeah, so it's very common here.
It's common. So don't feel like you're just a klutz if you happen to trip over the pavement or your own 2 feet. So tell us about the services that One Brooklyn Health is providing in this area.
Yeah, so we have complete imaging capacity. We have x-rays, MRI, CT scans, so we can diagnose injuries and create an individualized plan. We have physical therapy, and doctors specialize in non-operative treatments. And then if you end up requiring surgery, we have orthopedic surgeons, and we specialize in specific areas. So in my case, I'm a trauma surgeon specialized in limb reconstruction. Dr. Voigt is a sports specialist, so we can help out a lot of people.
Full service orthopedic team. Thank you both so much for joining us.
Thank you for having us.
It's a pleasure. Don't forget to scan the QR code to learn more about One Brooklyn Health's resources for orthopedic care. Thanks again. And coming up next,